It's a race against time for Africa's Center for Disease Control to set up systems that will ensure Africa is not left behind on securing the COVID-19 vaccine.
My speculation is that by January or so, or February, we will be where we were at the peak of this pandemic in July, August. So I think clearly the second wave is here. Let there be no doubt. We, as a continent of 1.2 billion people, have been saying that unless and until we strive to vaccinate at least 60% of our population, will definitely end up having COVID on the continent as an endemic disease again. And Africa has already enough endemic diseases that we don't need COVID to install and become disruptive and continue to challenge our health systems in the manner that other diseases have challenged that clearly.
President Cyril Ramaphosa, in his capacity as the African Union chairperson, set up a task team on the continent to deal with the procurement of the much-needed vaccine in order to generate funding to support Africa's demands.
The President of South Africa has put together a task force, a presidential task force, which I am a member, Commissioner Mira, Chairperson Musa Faki, Strive Masiwa, Donna Kaburuka, and others, and with a very aggressive mandate to make sure that we coordinate this effort, get vaccines for the continent, engage with bilateral as well as multilateral mechanisms to get vaccines for the continent. And we are doing just exactly that. We've met with nearly all vaccine manufacturers and have dialogue with them, and some of them are ongoing, and we'll continue to engage with them and bring the results to you all. I think we really want to make a strong appeal to the continent that going alone will not help the individual cause for the country, but we need to do it collectively.
He has also called on the United Nations Secretary General to convene a special session that will look at vaccine nationalism.
I reiterate my call for a COVID-19 vaccine to be a global public good, available to everyone, everywhere, and particularly available in Africa. Most African countries lack the financing to adequately respond to the crisis, due in part to declining demand and prices of their commodity exports. Once again, I appeal for a bold and coordinated international approach on debt relief efforts for African countries, including, where appropriate, debt cancellation, and the meaningful increase in the financial support to African countries to provide the necessary liquidity and to finance the recovery.
Sophie Mukwena, SABC News, Johannesburg.